Hi there, and welcome to our weekly Ask the Dietitian video. My name is Lauren. I'm a registered dietitian and a health educator at Virginia Tech with the Hokie Wellness team. Thank you so much for tuning in today. As always, our question of the day is a great one, and it is, where do I start with dietary changes when my triglyceride lab result came back elevated? That is a really great question. So I think it's first important to talk about what the triglyceride lab value even represents, because sometimes, many folks will go to the doctor, get their lab results back from their annual lab work, and have no idea what it means. You might find out that your triglycerides are elevated, but if you don't know what that means and what to do about it, then it doesn't really help a whole lot. So let's talk about that. Triglycerides are a type of fat or lipid in the blood. It's totally normal to have some level of triglyceride in your body. But once they get to a certain level, which is usually about anything over 150, there are a couple different tiers of classifications of elevated triglycerides, but usually it's anything over 150 in general terms. Then if it is staying elevated consistently over a period of time, it can lead to an increased risk of things like heart attack, heart disease, stroke, things like that, because this consistent elevation can start to harden and thicken the walls of your arteries. Higher than normal triglycerides can sometimes also be a result of things like poorly controlled diabetes, kidney disease, hypothyroidism. Even excess amounts of alcohol intake can also affect your triglycerides. And so, in addition to that, there are also certain medications that may elevate triglycerides as well. So it's important to discuss with your physician, what do we think is actually the cause of this elevation in triglycerides? So try to establish that. Regardless, if you do have elevated triglycerides, there are a few lifestyle changes that you can make that generally do really, really well to help with lowering this level. So let's start first with dietary changes. It's kind of my jam. I love nutrition, so let's start with dietary changes. I'm just going to give you two or three to make it sort of manageable to start with. It's kind of better to pick a few really manageable things to do and to try rather than to tackle everything at once. So the first thing that I would do is take a look at your eating pattern and think about what types of fat specifically you are including in your diet most often. So there are a few different types of fats: saturated fats, trans fats, and then there are a few healthy fats. And healthy fats are the ones that we really want to be including in our diet for the most part. Saturated fats should be consumed in moderation. I hardly ever say don't consume this or that, but probably would say that about trans fats. There is no benefit to your body that trans fats can give you. So if there was one thing you were going to kind of cut out, that would be it. So just a moderated intake of saturated fats. Just kind of try to limit it the best you can. Doesn't mean you can't have it ever. Just try to limit it and be mindful of it. So saturated fat is found in things like full fat dairy products, butter, cheese, whole milk, fattier cuts of meat, sausage, bacon, things like that. And so again, it's not that we have to completely cut those out. It's just really be mindful that an excessive intake of those can have an effect on your triglycerides. In contrast, healthy fats are going to be so good for your body. And so just try to add those in where you can. Things like chia seeds, flax seeds, switching from whatever you're cooking with now to cooking with olive oil. Things like including certain types of fish, avocado, things like that. Those are all really good examples of healthy fats. And so, once you've taken a look at what your typical eating pattern is, if you see any opportunity to make any of those changes with the types of fats that you are consuming, that's a really great place to start. Second, another good thing to maybe look at is reducing refined carbohydrates and sugar in your eating pattern. Again, let's not cut carbs out completely. We don't want to do that. It's just replacing refined carbohydrates with better choices for your body. And so this might mean that you switch from eating white bread to whole wheat bread. This might mean that you switch from eating sugary breakfast cereals in the morning to choosing oatmeal instead. It might mean that if you're making a stir fry with rice, you throw in brown rice versus white rice. It's just small changes that can really, really add up over time. In terms of your carbohydrate choices, it's really a great idea to try to get as many of your carbohydrates as you can from whole grain foods. And then just trying to limit sugar where you can. So if you're someone who's drinking a lot of sugary beverages at this point, maybe starting with just cutting them in half throughout the day and switching half of those for water or another sugarless beverage, and then just kind of continuing to work towards that over time. Additionally, make sure that if your triglycerides are high, that you're really being mindful of your alcohol intake. So alcohol intake in an excessive amount really does have a noted effect on triglycerides. And so just be mindful of that and kind of think about that. Other than diet, there are a few other things that can definitely help with lowering your triglycerides, and one of those is simply physical activity. And so a good rule of thumb is to try to get about 30 minutes of physical activity on most days of the week. And so if this is something that's totally new for you, or if you're finding that you really want to get some physical activity, but it just isn't happening, then put it on your calendar. Schedule it just like you would schedule a meeting or an appointment that is non-negotiable. You have to be there. When we have an appointment or a meeting on our calendar, it kind of becomes non-negotiable at that point unless something changes. And that is really a good way to treat physical activity. Getting that movement, giving your body that good movement really is a gift to your body. And so it's something that I would really advocate to protect that time, that you have scheduled for physical activity. Protect it like it is important to you, because it really, really is important to your body. Physical activity does play a very important role in reducing your level of triglycerides. So start with maybe one or two things that you heard me talk about today, and that should get you started on the right track. As always, we are available to help you in any way that we can in Hokie Wellness. You can reach us at hokiewellness@bt.edu for any questions at all that you may have. Thanks for tuning in to this week's Ask the Dietitian, and we'll see you next week. Thanks so much.